delivery up there.
What's up, guys? Welcome to BFR Tuesday. So, already in October, unbelievable. Yeah, so my name's Cara. I'm here to answer any questions you have about blood flow restriction training in, about 15, 20 minutes or so. During my lunchtime on Tuesdays. So you can just type in any question you have in the upper right corner. There's a chat section. You can say hello or write a question, and I'll get to answering them. Hey, Terry, how's it going? How's beautiful Georgia this lovely fall day? I'm going to be there in 2 weeks, Georgia versus Kentucky. Looking forward to visiting Athens. So knee buckling, is that what you're saying? You're getting Abe is minor buckles infrequently. I'm assuming, Abe, you mean knee buckling. Oh, Terry, you live by Athens? Oh, that's nice. You go to a lot of games? Oh, all right, fair enough. Not a football fan, I get it. All right, so Abe, confirm if you're getting buckling of the knee. I'm assuming that's what you mean. If that's what's happening, I would focus on quadricep strengthening. I would focus on quadricep strengthening and hamstring strengthening. I've got some suggestions on my YouTube channel, but you can, like a long arc quad is, a good option. Straight leg raise, good option. And I would do it for strength. So you're going to do light loads, but light compression, so lighter. So in the lower extremity, you'll do 60% limb occlusion pressure, and you're going to do heavier loads. So you're going to do like 40% of whatever your 1 rep max is for your leg extension exercises. That's what a long arc quad is, basically just a long is a leg extension. So I would do that, and I would do some hamstring stabilization as well. Okay, starting to do some hamstring work. That's good. I like it. Yeah, so hit those hamstrings as a focus point for a while, for like 4 weeks, 6 weeks, and see if that doesn't continue to improve. Best hamstring exercises. You can do standing hamstring curl. If you're at the gym, then a standing hamstring curl is a good one. I like rollouts on the ball. So you lay supine with your feet up on the ball and elevate your glutes up and then pull the ball into your butt and then let it slowly back out. In and out. That's a good one. Trying to think what else I do. If you have a TRX suspension trainer, I like the TRX hamstring curl or the TRX hamstring runner. I use the suspension trainer a lot with my rehab, so those are pretty easy to do, and you can kind of control the load very easily without a bunch of weight. So those three are probably your best shortening concentric type work. And that's what I would recommend for this, because I'm guessing, like most of my tennis players that I work with, they are very quad dominant, and it's with the knee bent because they're in a ready position for the ball. And so doing the hamstring work, not like a deadlift or a straight leg deadlift or a good morning where you're lengthening the tissue, but you're shortening the tissue concentrically, is I think a better option. Yeah, that's what I would do. What else? Anything else? Okay, want to talk briefly about on-ramp. So an on-ramp is when you first get your cuffs or you've been a long time without the cuffs, doing lighter pressures and lighter loads to get used to the cuffs. For 2 weeks, I would recommend ramping up to the highest pressures. So in the lower extremity, you're going to use 60% limb occlusion pressure and do 1, maybe 2 exercises per session. And then in the upper extremity, 40% limb occlusion pressure and doing 1 or 2 exercises per session. And then increasing one or the other, pressure or the number of exercises, but not both, on sequential sessions. So session 2, you might do the same, pressure, but maybe add an exercise. And then sequence 3, you might do increase the pressure to 45% in the upper extremity and 65% in the lower extremity, but keep with the same number of exercises as you did to the prior. So I normally don't recommend increasing pressure and number of exercises in one session, especially during the first 2 weeks of the on-ramp. So I'm going to type this in just so you have it. On-ramp. Okay, thanks. Lower pressures to start and less exercises. At 1 to 2. Then each session increase pressure by 5%. Yeah, 5. Yeah, so 40 to 45%, 45 to 50%. Yeah, that's right, by 5%. Don't increase pressure and weights in the same session. All right, Paul, as far as frequency goes, how many times would a patient come in to get the results of increased strength? What's the least amount of times? 2 times a week, 2 to 3 times a week has been shown to be as effective as 5 times a week with BFR. So 2 times a week is my minimum that I'll have them come in. Okay, great. So yeah, If you've been doing that, feels strong in the knee, what I would do is start varying your tempo then. I would start, instead of everything being 2 seconds concentric, 2 seconds eccentric with no hold in between each, meaning I'm 1001, 1002, 1001, 1002. That's the kind of the normal prescribed tempo. I would start varying the tempo so your brain starts catching up to increases speeds and more dynamic. So you might go very slow, lower, and fast. So 1 second up, 1001, 1002, 1003. 1 second up, 1001, 1002, 1003. So varying the tempo then if you're already at the highest pressures and you're using pretty good loads can just kind of help the neurological system catch up with the muscle, because the muscle, the knee is buckling because the muscles are not firing as when they should be. So you're getting a little bit of a lag. So you're trying to get those to catch up. So that's a good way to do that. And the study that we did at Jacksonville State was 2 second eccentric, 1 second concentric. We did it mostly with squat and bench, but we saw crazy changes in power when we did it that way. So there's something to it. It hasn't been studied a lot. Hopefully it'll get studied more. I think we're going to do a validation study on that, but the tempo could be a good variable to change now too. Cool. All right. If I don't have any other questions, stick to your on-ramp program the first 2 weeks. And then after your on-ramp, I recommend going to a hypertrophy. So after on-ramp, do a periodization block of hypertrophy. When we're doing hypertrophy, is using very light loads, so 20%, 1 rep max, with higher pressures. So like 50% upper extremity, you're probably going to be like 70 to 80% lower extremity. And also using isolated exercises. So bicep curl, I'm trying to increase the size of my bicep. I'm using 50% limb occlusion pressure. I'm using 20% of my 1 rep max. And I'm going to do isolated movements. I'm going to do bicep curl, hammer curl, tricep extension. I'm not going to do dynamic bench press multi-joint, pull down multi-joint, rowing multi-joint. We'll save those for strength training, where it flips. It's the opposite. It's lower pressures, higher resistance. And so you're playing with some variables in order to maximize your training sessions. Yeah, I would alternate as well too. I think with tennis, 2 days a week of lifting, if you're playing tennis a couple days a week, I think that's enough. And then giving your body rest is super important, especially for your wrist extensors and your elbow. My tennis players overplay for sure. That's most of the time why I'm seeing them. All right. If there's no other questions, thanks you guys so much for, my BFR book shipping date. I know, it's taking forever. I'm waiting for Amazon to approve. Supposedly, it's supposed to be approved this week. So hopefully we'll get those out. And then once that's approved, then the audiobook will be approved and then the digital book will be approved. So I'm just waiting for Amazon to get back. So hopefully that will be this week. Latest is next week, once they give me the thumbs up. So sorry for the delay. All right. Thanks you guys so much. See you next week. Bye for now. you.